got two out of 6 that are.
Make a disclaimer, 2 disclaimers. One is, you know, I want you to be, everybody have to ask the doctors. Every individual have his own medical history and medical issues. So everybody's different. So this does not apply to everybody. But please check with your doctor if you have special allergies or special needs. Please connect with your doctor. The second disclaimer is there's going to be some discussion of some medications. I have no financial interest in any of those companies or products whatsoever. Okay. The third disclaimer is I have my dog sitting on my lap. So if she shows up because she's, you know, cuddling with me because my kids are leaving her with me, please forgive her. She needs some love. With that, I'm going to share my screen, and please let me know if it shows up. We're good? We're good, Robert?
Yeah, we're perfect.
Okay.
Thank you.
Perfect. So I usually start my my presentation saying it would be very bad if I make a typo on the first slide. You know, my name is truly Samuel. I have the same first and last name. So it's really not a typo, it's real, okay? So I'm gonna talk to you about the allergic reaction from mild to fatal. Okay, the purpose of this talk is really not to make you afraid or panic about, you know, the extremity of the allergic reaction. However, it can happen. So please, you know, be cautious, be prepared, and so on. So just a quick introduction. I'm sure this is not new to you, but Hymenoptera species that can sting humans actually include bees, wasps, yellow jackets, hornets, and imported fire ants. This is a picture, beautiful picture of a beautiful creature, in my opinion, called the honeybee. I'm sure most of you are very familiar with the honeybee. This is a wasp. And please correct me if I'm wrong, but these are high quality, high definition images of these insects, flies. This is a yellow jacket. And that's a fire ant. I'm sure most of you are very familiar with them, but others who may be around you or your family may not be aware of them. So it's a good, I can leave this presentation with Robert and he can leave it with you in case you want to present it to others and show them how do they look like, just in case they see them or they encounter them, they know what they are facing with. So what are the type of allergic reaction? I'm sure some of you have gone through some reactions, but I'm gonna go quickly through the different reactions. The number one is the minor local reaction. From what it sounds, it's a minor reaction. The major, what we call anaphylactic reaction or anaphylaxis, which is the medical term for a potentially fatal reaction, okay? Where your eyes swell up, your lips swell up, numbness in the face, numbness in the hand, shortness of breath, tightness on the chest, so on and so forth. So really 2 types of reaction, a minor local reaction and a major anaphylactic reaction. Why the sting? You probably almost know, but most of the stings are for self-defense, to protect the nest or to protect the hive. So, you know, not sure which circumstances happened with Robert, for instance, but most of the time there is a sense of self-defending. And I think it stands true with any animal species, you know, any of the animal species. They don't just attack for the sake of attacking. They are usually have a sense of threatening to their nest or to their hive. It's acutely painful, although you may not see the actual insect. So that's very important. The important thing is you might not see it, but you will feel it. So really don't question yourself if you feel it, trying to say there is no bees around me or there's no wasps around me or there's no ants around me. If you feel it, you've been stung. It's hard to differentiate which winged Hymenoptera species as the lesions are similar in appearance. Now, for the advanced honey or a beekeeper, probably much more experienced than myself, but it may be slightly different and they can recognize it. However, for the lay person, it's hard to differentiate which species have stung me. So don't assume it's a wasp versus a honeybee versus a yellow jacket. However, the culprit species can be identified based on the nest location, appearance, geographic location, or setting in which the sting occurred. So you're a beekeeper, you're going to a colony, you're dealing with honeybees, you get stung, guess what? It's probably a honeybee. However, for me as a lay person, I'm not a beekeeper. I walk into my backyard, I get stung. It could be a yellow jacket, it could be a honeybee, it could be an ant, it could be so on and so forth. So really, for you as experienced operators, you might know the culprit. For the lay person, if you encounter somebody who gets stung, it may be hard to differentiate which species. And by the way, the treatment is the same for the different species for most part. Okay, how about insect and stinger removal? Bees, and I think Robert corrected me, yellow jackets don't have a barb stinging. Honeybees, they become lodged in the skin. And venom is released within seconds. So really, if you present to me as a health provider, after, let's say, 2-3 minutes, removing the actual barb sting is not my priority because the venom is in your system. However, if you get stung by a bee, first thing you try to do is to remove the sting as soon as possible. This way, the amount of venom that gets into your bloodstream is less. Try not to squeeze the stinger when you are trying to remove it because that will push more venom into the bloodstream. Removing the insect and the stinger may limit the amount of venom injected. So really, the first step you should take is to try to remove the insect and the stinger from your body again as soon as possible without squeezing the stinger. As we said, if you present more than a minute after being stung, you should remove the stinger. However, if you are in a more advanced stage, that becomes a second priority than treating the actual emergency at hand. Fire ants grasp the skin with the mandible, and they do multiple stings per insect, which should be removed. So fire ants actually is a bit more aggressive. They do multiple stings, and they should be removed promptly. Now, I'm going to show you a picture of what a local reaction looks like. And there is a dime next to it, so you can get a feeling of the size of the sting and the local reaction that developed after that. You can see this is the back of a person. And usually you develop a redness and painful swelling between 1 to 5 centimeters. It develops within minutes and usually resolves within hours. This we're talking about just a local reaction. Occasionally, swelling may last 1 or 2 days. Treatment, usually called compresses, mild antihistaminic, 1% hydrocortisone cream, usually limits the reaction. Okay, we're talking the minor local reaction. You can see some redness. You can see the center of the sting. You can see the dime. So you can kind of, so something very interesting we do in medicine is when you get a redness or swelling like this, you want to get a marking pen and mark it. Do a marking around the perimeter of the red area. The reason is you want to know if it's progressing or regressing. You say, you know what, I will eyeball it and I will know. Believe me, you won't know. You want to mark it. So this way you want to know it's regressing rather than progressing. If it's progressing, that could potentially be a problem. Okay, so you get a marking pen and you go around the redness.
So doctor, you mentioned a couple of things we can do. So one of them is apply cold pads or ice to it and
Yes.
compress it, right?
Yes.
What we're trying to do is what, to prevent the venom from spreading, or are we trying to prevent the body from pushing more fluids towards that area?
So what happens is with any sting or an injury, the first thing you want to do is ice. So let's say, regardless of the bee sting, let's say you sprain your ankle, okay? The first thing you want to do is you want to ice it. The reason you want to ice it is because you want to limit the swelling and the inflammation that happens right after the incident, the body trying to fight back. However, when the body fight back, there is swelling. With swelling becomes pain. With swelling becomes restriction of the blood supply coming to the area for healing, and pain, and potentially going into the worst, cascade of things. So ice is to limit the amount of inflammation, limit the swelling, limit the pain.
Okay, thank you.
Okay. So again, for a minor local reaction, the first thing you want to do is to remove the stinger if it happens without squeezing the stinger. Cold compresses. You can do a mild 1% hydrocortisone cream, Benadryl, and mark it with a pen. So this way you know that it's actually regressing rather than progressing. Now, fire ants, you can see the picture behind the slide. Fire ants shows multiple stingers. They look like what we call pustules. Pustules comes from the word pus, but actually they are not infected. Okay, so that's very important because the way fire ant looks like, you would think it's infected and I need antibiotics. Actually, what happens is most people want to pop them and they become infected rather than they are infected. Make sense? So we call them pustule, but these are called sterile pustules. In other words, they are not infected. Okay, so they form within 24 hours. They're actually sterile, so do not be tempted to open them, Otherwise, they will get infected. The other reason they get infected is because they become intensely itching. Okay, so you start scratching them, you pop them, you get infected. Okay, so resist popping them. Itching is hard to resist. Again, you can use some cold compresses, you can use an antihistamine, and hopefully they will improve slowly. Okay. Now, this is what we call a large local reaction. So, this is definitely bigger than 1 to 5 centimeter, in diameter. Actually, only 10% of individuals develop exaggerated redness and swelling. So that's also important to mark the initial local reaction. So this way, you know that it's actually getting into a large local reaction rather than going into a resolving. So you want to mark it. But this only affects 10% of the individuals. And it actually enlarges over the 1 or 2 days, unlike the minor local reaction, which actually regresses over a day or two, okay? We call those the LLR, or large local reaction. They peak within 48 hours. They resolve within 5 to 10 days, okay? And they measure about 10 centimeters. So they are almost double the minor local reaction, okay? So this is a local reaction, but rather than being minor, it's large. How to treat it? Again, cold compresses. In this case, we might consider giving oral prednisone, okay, 60 milligrams or so, and non-steroidal anti-inflammatories, Motrin, 800 milligrams 3 times daily, as long as you don't have any contraindication. You don't have kidney disease, you don't have an active stomach ulcer, you're not on a blood thinner, okay? So again, that's why it's important to consult with your physician if you can take that. You should take oral antihistamine like Zyrtec over the counter, 10 milligrams, or a high potency steroid. High potency steroid is not the 1% hydrocortisone that you have over the counter in the pharmacies, okay? The 1% hydrocortisone is not gonna do much for a large local reaction. You might need what we call a high potency steroids. These are prescriptions, and you should not be using them for long duration. Okay. The Hymenoptera stings are considered clean. In other words, you don't need a tetanus vaccination if you get stung by a honeybee, a wasp, or a yellow jacket, or even a fire ant. Okay, you don't need a tetanus vaccination. So you can see that the treatment of a large local reaction is a little bit more involved than a minor local reaction.
So
what's this?
I'm sorry to interrupt, but is it wise to have that prescription medication on hand? And is there an expiration date to it? And will a doctor, if we ask for it, will they prescribe it for us?
Yeah, so you know, I work for the clinic, and nowadays we have, you know, what we call my chart. We have, so the beauty of technology is you can take a picture of it with your phone, send it to your doctor, and say, here's what I'm getting. I heard from Dr. Samuel, this is called large local reaction. It's not a, you know, small reaction. It's not a minor reaction. It measures, you know, 7 centimeters. That's a large local reaction, and therefore I might need some prednisone. I can e-script it or send it through the computer to your pharmacy, okay? So most of people have cold compresses. You might need prednisone if it happens. Oral antihistamines, you should start with those ASAP. So these are over the counter, you know, Benadryl, 25 to 50 milligrams every 6 hours as needed, okay? Motrin is over the counter. Most of the Motrin over the counter is 200 milligrams. Advil, same thing. 200, usually they are 200 milligrams per tablet. So you want to take between 2 to 4 tablets up to 3 times a day. Again, with the precaution that you're not on a blood thinner, you don't have a gastric ulcer or a stomach ulcer that's active, you don't have kidney disease, and your doctor said stay away from anti-inflammatories, okay? Tylenol will not do anything for any of those. So, cold compresses. So in order, maybe I should flip it a little bit, because your non-steroidal anti-inflammatory, your oral histamine are readily available. You can have them on hand because they're over the counter. Have those, start with those first until you can contact your doctor with a picture so they can send you oral prednisone if it does not resolve with the over-the-counter medications.
So are you able then to take, let's say you take 50 milligram of Benadryl, and do you wait a certain time before you can take Motrin 800 or 400 milligram or whatever you have?
No, you can take Benadryl and Motrin, both.
You can take at the same time. Okay.
Correct. Remember, Benadryl is antihistamine. It's going to make you very drowsy, so you don't want to drive. Okay. Zyrtec, so there is a slight difference between the cetirizine or the Zyrtec and the Benadryl. Zyrtec is what we call a non-sedating antihistamine. Okay, so there's a slight difference. So if you want to take something that's non-sedating or it doesn't make you sleepy, take the Zyrtec. Okay, Benadryl will make you drowsy. So there's a slight difference between the Zyrtec or the other non-sedating antihistamine and the Benadryl, which can make you sedated.
Where is it?
Any questions before we move to the next slide?
Hey, I'm doing another bee thing on the Zoom. Can I call you when I'm done? Okay.
If you would please mute yourself. If you're not muted, I can also force mute everybody, but I'd rather have you guys participate. If you have any questions, please feel free to unmute yourself and ask the question. Or you can hold off till the end, or you can throw it in the chat room, and we'll ask the doctor the questions at the end.
Okay, Robert, you can still hear me?
Yes, we can hear you.
Okay, perfect. So again, we said the Hymenoptera stings are clean. You don't need an antibiotic unless it gets infected. You don't need a tetanus vaccination. Large local reaction occurs only in 10%. So 1 in every 10 people who gets a reaction will get a large local reaction rather than a minor local reaction. Okay, so what's the risk of a systemic reaction after a large local reaction? So that's where things gonna start getting a little, more serious. If you get a large local reaction, that means that your body is responding in a more robust, reaction to the sting, and the incidence of subsequent major systemic reaction is actually higher. So if you get one of those large local reaction, I would be more cautious about having on hand an EpiPen or a prednisone and so on, okay? The systemic reaction is about 7%, all right? So you can get a systemic reaction, meaning itching, urticaria, where you get these bumps on your skin that become itchy. Not necessarily the more advanced systemic reaction, which the more severe reaction is less than 3%. Okay, so as you can see, it's quite rare. However, you might be getting some warning signs if you get a large local reaction. Okay, if you get a large local reaction, but you get a systemic reaction where you get the elevated bumps, which we call urticaria, this is a warning sign that it might get even more severe. Okay, so be attentive, be on the safe side. There's another study showed actually high rates, almost 16% systemic reaction, 11% was serious. So we're talking serious anywhere between 3 to 11%, which is overall is not a small percentage. Okay. So again, if you get a large local reaction, which is about, between 5 to 10 centimeters, the risk of systemic reaction, non-serious, is about 7 to 16%. The severe, serious, anywhere between 3 to 11%. Okay.
Dr. Samuel, question.
Yes. Yeah.
So these numbers here, people, 7% of the people have a systemic reaction and stuff. Is this regarding one bee sting, or would this be like if Robert, he had 130 or whatever a number is? Would everybody have a systemic reaction if there was enough stings or enough venom involved?
Of course. So that's very good. I'm glad that this was brought up. So, I looked at the studies. It was not very clear, but, common sense says the more the venom, the more the potential reaction. Okay. So if you get stung by one bee, your reaction might not be as severe as if you get stung by 100 bee or more. Now, again, some people are more allergy prone than others. There are genetic preponderance towards getting an allergic reaction to a bee. And believe it or not, sometimes if you get stung more than one time, your body starts developing what we call memory cells, that it's going to be responding to the subsequent stings in a more aggressive way. Okay, so the more bee stings, the more likely the reaction is, because the higher the amount of venom into your bloodstream. Okay, but again, you get some warning. If you have a history of allergy, if you're asthmatic, if you're very easily get any artificial substances on your skin, you get allergic and it gets red, it gets itchy. Your response to a bee sting might be more serious than somebody else. Okay. If you get a large local reaction, your chances of getting a systemic reaction is higher. If you get multiple bee stings, your systemic reaction is going to be higher. Okay. Does that answer your question?
Yes. Thank you very much.
Perfect.
Dr. Samuel, in my case, okay, I get stung and I get a tiny itch for a couple of hours and it's gone. Okay, so I wouldn't call myself allergic, but I was warned by the doctor that my body can go either way after the trauma that I went through. And so the first time I got stung after that incident, I immediately closed the hive and ran home, just holding the EpiPen because I wasn't sure how my body is going to react. But luckily, I swung to the opposite direction. I've been stung several times after that, and there's really no reaction to it. But one thing I've learned from my experience is that when I got stung, I never got stung in the face. Okay, it was all in my legs and my back, because as I bent over trying to clean my pants and my shoes, they were stinging me because my jacket pulled up, and so they were stinging me above my belt, right on the skin. But my face, one thing I've noticed is that my face, it felt like I have a cold. I couldn't breathe through my nose. And then my lips were swelled up. My eyes were puffed up. And that was the first symptom that I got. And then I took Benadryl immediately, 50 milligram of Benadryl, and I took 800 milligram of Motrin. And within an hour after that, everything calmed down. So that's when the EMS came and they took my blood pressure and all that, and everything is perfect. And so I didn't want to go to the hospital. And then about an hour later is when my entire body broke out in hives, tiny. It looked like pussy hives, but there was no pus in there. But my entire body was itching. And I remember my wife and my daughters were just scratching my skin, helping me scratch my back. And I'm like, I'm itching all over. And that should have been the sign for me. One, I never got stung in the face, so why is my face swelled up? And maybe I should have reacted immediately. Hey, there's a major problem here. I should go to the hospital versus being stubborn and acting like the big guy. You know, I'm tough. I don't need to go through this. So guys, if you you need to stop everything and listen to your body. You need to see, is this local? Is it a large local reaction, or is it spreading all over your body? And if it is, you know, Benadryl may or may not help you, but you know, it's better to go to the emergency room, pay your $500 deductible than to do what I did. I'm still getting bills, and I'm up to $4,500 in bills from the hospital. So I just wanted to say that because a lot of people, we can talk and see pictures. It doesn't all happen. It could all happen at once. For me, it was like different stages, and now I know what to look for. And really the reason of this presentation is to bring awareness to you guys. You know, you didn't get stung in the face. Why are your lips swollen? Why is it you can't breathe from your nose? You're all puffed up, your eyes are swollen. You know, listen to your body. And sorry for the interruption, Doctor.
For sure, no problem. So really, I'm glad Robert is giving us, you know, his testimony, because here is the key word in his story: systemic. Okay, so the minute you start getting itching away from the site of the sting, you're developing a systemic reaction. Once it goes into systemic reaction, Benadryl is not going to do it. Okay, Benadryl is not a strong anti-allergy medication. Okay, it is not strong. You have to, you know, so once you start feeling, you know, lips getting swollen, nose getting swollen, itching all over, you're getting a systemic reaction, you should act fast. Okay, you know, and I hear Robert saying, you know, nowadays, you know, my deductible is $5,000. I'm going to go to that emergency room, you know, and I'm going to pay, you know, $200 deductible, $300. You know, life is so precious. You know, don't delay your treatment based on money, please. You know, your life is much more precious than any money in the world. Okay, so the key word is systemic. You know, you start getting numbness, tightness in the chest, sweating, itching, no joking around. You need to go to the emergency room. Okay, so systemic allergic reaction, or the other name for it is called anaphylaxis. This is a serious allergic reaction. It may be fatal. The venom is induced signs and symptoms remote from the sting site. So this is the key. The key word is remote. Okay, you get stung in the face. I started itching in my hand. I get stung in the face. I started getting swollen eyes. I got stung in my foot. My belly is itching. Okay. A single sting is sufficient to induce a severe reaction. However, the more the stings, the more likely the systemic reaction. Okay. Now listen to this. You think I'm going to get one epidose and I'm done. You might need 2 or 3 or 4 doses of epinephrine. Okay. The reason is epinephrine is a very short-acting medicine. It lasts about 5 minutes, but it's a very potent medicine. And that's why you need to break the cycle of the anaphylaxis by giving 1 or 2. So this may be new news to some of you and your loved ones, that, you know what, maybe I need the 2 EpiPens. If I give the first one and I'm doing okay, I'm not out of the woods yet. You need to be watched. You need to be observed. Okay. So what's the incidence of anaphylaxis? It's actually very, very low. It's 0.3 to 3% of the stings. So 1 in 3 out of every 100, anywhere between, you know, 3 in every 1,000 to 3 in every 100. Okay, that can develop into anaphylaxis. So it's pretty rare. You know, 8% in some populations. So in certain population, you know, population of, you know, people who are very allergic or asthmatic or have a history of eczema or urticaria, maybe slightly higher. Now, this is actually the good number that I want you to also look at, so you don't panic or say, you know what, this is serious. It only accounts for 40 deaths annually in the United States. So it's really extremely rare, you know, instance. However, this may be a little bit undernumbered. So the fatal incidence might be higher because sudden death may be attributed to heart attacks or strokes. You know, me going out, working on my yard, God forbid, my wife finds me, drop dead on the lawn, he had a heart attack or a stroke, where in fact I had an anaphylactic reaction to a bee sting or to a wasp or a fire ant. Okay. This is what's interesting. There is a high frequency of venom-specific IgE, which is the allergic antibody that develops in the post-mortem serum of individuals who died suddenly outdoor. So in other words, individuals who died outdoor, we took their blood and they had high frequency of the venom-specific IgE. So now it becomes questionable, was it a really heart attack or it was an allergic reaction? Okay, so you get the point. The point is, being an outdoor, dying suddenly, most of the deaths are called heart attacks, which could be, but some of them are actually anaphylactic reactions to sting. Okay. Also in the post-mortems, they found high elevated serum tryptase, which is the triggers for the anaphylactic reaction. Okay. Now, 3% reported systemic symptoms. So remember, not every systemic symptom is going to turn out to be anaphylaxis. Okay. 2% of the adult population could have a venom allergy. So 2% of the total population could have an allergy to the venom. And luckily in children, it's 1/4 of that. It's only 0.5% of children. 50% who die from a sting didn't know they had an allergy. Okay, so half of the people who died knew that they had allergy and they didn't get to the treatment fast enough. The other half had no clue they had an allergy, like Robert, for instance. He didn't know that he had an allergy. He got stung multiple times before. So the point is, getting stung multiple times does not mean, and you didn't get a reaction, does not mean you're not going to develop a reaction or a serious reaction subsequently. Okay. Now, this is the alarming part, is the majority of people did not, and you can see it written in capital, did not seek medical attention. Okay, so please, if you develop any kind of a large local reaction, know that the next subsequent reaction might be more serious. If you start developing itching or any symptom remote from the sting side, please, please, please have your EpiPen ready, seek medical attention, get with somebody. Don't be alone. Don't go to sleep. Don't go to a bed and say, I'm going to sleep it out and everything's going to be okay. All right. Don't depend on Benadryl. In those cases, Benadryl is not going to help you. All right. Venom allergy can develop at any age, but adults, as we said, have more severe reaction. It's more common in men than in women. Okay. Maybe because men can be outdoor more, possibly, but that does not explain the gender difference. Guess what? I'm preaching to the choir here. Beekeepers are at highest risk. Anybody have any question about that? I think it's quite obvious, right? You deal with bees, you can get stung. Okay, I'm a physician. I work in a hospital. I'm not exposed as much. Yes, I go to the outdoor, but again, I'm not into colonies or hundreds or thousands of bees around me. Okay, individuals who have cardiovascular diseases or poor tolerance to biochemical and physiologic stress are at particular risk. So people who have, coronary artery disease, or they have high blood pressure, or they have asthma or COPD, or they know that if they smell a fragrance, they get, wheezing right away, or if something touch them, they get itchy immediately. You are more at high risk of developing an anaphylactic reaction than others. Or people who have what we call atopic dermatitis, or people who have eczema. These are all allergies. So your body is, have nuclear weapons ready to go if you get stung. You get the point, okay?
So we have a question, Doctor, about, this is Gary Nolan is asking, should we have an EpiPen with us all the time? And what if the doctor does not prescribe it? Maybe the doctor, like my doctor was hesitant to prescribe it to me until I told her when I get stung, I get a reaction for a couple of days. And I told her I have beehives, and she said, okay, then I'm gonna go ahead and prescribe it for you. And she went over the procedures. You can't take an EpiPen injection and go lay down somewhere. You got to go to the hospital because you could end up with a heart attack. So if you can touch on that, how can we get an EpiPen, and what, once you inject yourself with it until you get to the hospital, what can you expect, or what should you expect?
Sure. Thank you for the question. Number one, I think if you talk to your doctor, face to face, not on a message, when you go in to see him, say, I'm a high risk for an anaphylactic reaction because I work with bees. I don't think any doctor would say no. I think this would be, a no-brainer to me as a physician to say, you're a high risk for a bee sting and an anaphylactic reaction. I have no problem giving you an EpiPen. Now, if you remember about 2 or 3 years ago, there was a big uproar about EpiPen because Mylan, which is the company who manufactures EpiPen, increased the price of EpiPen from a couple of $100 to actually $900. So really, it went up to a crazy price. Now there is a generic form of EpiPen now for about $360. If you use the GoodRx coupon, if you're not familiar with GoodRx, you get ads all the time. It's called GoodRx. You probably can get it for about $169. Okay, so that's probably the cheapest of the EpiPen. I would talk to your doctor face to face and say, I'm a high risk because I work with bees all the time. If you don't mind, I would like to have it at hand in case. Now, the way to use an EpiPen is you want to inject it in your thigh, the outside of your thigh, because that's where your biggest muscle is. Once you inject it in, you're going to feel your heart racing. You're going to feel your chest pounding because epinephrine increases your blood pressure, increases your heart rate. And as I told you, it will last for about 5 to 7 minutes. And you may need a second injection if needed be. So don't just say, I got the first one, I got the EpiPen on time, I'm good, let me go back out or stay away from people. Absolutely not. You need to, if the EpiPen, because you're getting a reaction, you need to go to the emergency room to get checked out. Somebody who have a heart disease, this might be an issue because it will send your heart rate into the 140s, like running a marathon, okay? Like running actually a short spurt. Your heart rate goes to 140, 150. Not everybody is gonna, this is like a stress test, okay? Not everybody is gonna pass the stress test. You might get chest pain if you have heart issues. So please seek medical attention. If you inject it, have the second one ready, stay close to somebody, tell somebody I got stung, I'm itching, I'm getting, scratchy throat, I just injected myself with Epi. Get somebody to know exactly what's happening, okay? Please let me know if I answered the questions, or I would be happy to answer.
No, you have. Is there a way to store the EpiPen so you can prolong it? It's like my understanding that an EpiPen lifespan or efficiency is only, I can't remember if it's 6 months or a year. So do you store it in the fridge? And when you go to do your inspections, you have it on you?
To my knowledge, and please, when I don't know, I would say I don't know. I don't believe you need to keep it in a fridge. Definitely have an expiration date on it. Some people would say as long as it's clear, it's good to go. Here's my advice to you: if you have an expired EpiPen, but that's the only thing that you have, go ahead and use it. Okay. The risk of using an expired EpiPen is lower than the risk of not using epinephrine at all. Okay, you should update your EpiPen, always not to expire. Always look into the clear column of the EpiPen where you can actually see that you have not used it before or it didn't leak and it looks clear. Okay, and look at the expiration. Again, I'm not advocating using an expired EpiPen. However, an expired EpiPen is better than no EpiPen, if that makes sense.
Thank you.
Okay. Signs and symptoms, you can see the picture on the left side. Definitely some swelling of the lips. You might not notice it. Your wife or your significant other might. Okay, or you might start feeling a little scratchy throat, or your face is a little swollen. These are signs of a systemic reaction anaphylaxis. Okay, so the skin symptoms are urticaria, which is itching, bumps, all over your body, flushing, angioedema. Angioedema is what you're seeing right on the picture there, swelling of your lips. Respiratory symptoms, you start feeling your voice is getting hoarse or getting a little bit different or a little deeper, shortness of breath, and wheezing. Some people just start wheezing. That's it. You don't need more signs. You're getting a systemic reaction. Cardiovascular symptoms, you might feel lightheaded. You might feel fainting, low blood pressure, sense of chest tightness. If you get any of those, you're having a systemic reaction. It's not a local reaction anymore, okay? Get ready for what comes next, okay? Get your EpiPen ready, get close to people, tell them what's happening, seek immediate attention, okay? Here is a picture of an EpiPen. Most of you have seen it before. It comes in 2-pack. So the treatment is EpiPen, epi, okay? That's the first thing you go to. If you start getting a systemic reaction, you can get some antihistamine, you can take some Benadryl, have your EpiPen ready. Getting worse, you inject yourself. Don't wait, okay? Call for help. If you start collapsing, this is for the family around you or friends. Keep the patient or the person on the ground. Elevate their legs because you're going into a shock. So the reason you elevate your leg is you want to bring some of the blood, instead of being in the legs, which is not doing much, back to your heart because your blood pressure is going down. We need some blood pumping out of the heart going to your brain. Oxygen if available, IV fluids if you have an IV, albuterol inhaler. Antihistamine is the least at the bottom because you're already pushing epinephrine. You're giving IV methylprednisolone, which is a prednisone or a steroid, because you're getting into the systemic reaction, okay? So the first part is the EpiPen is your local treatment right there and then. The rest, call for help, recumbent position, oxygen fluids and albuterol and antihistamine can come into the hospital as you go to the emergency room or to the hospital. Final thoughts, I'm going to leave you with that. There is something called venom immunotherapy, which is the long-term treatment. If you get an anaphylactic reaction, they start injecting the venom slowly under your skin, so your body slowly get exposed to the venom, and it doesn't look at it as a foreign body anymore, so you don't get as an aggressive reaction to it. Don't wait for things to get better. We tend to do that. Oh, everything's going to be okay. No, I'm itching. I'm having scratchy throat. Please don't wait. EpiPen, seek immediate attention. Stay with people. Tell them what's happening. Don't go to sleep. Don't sleep it out. Okay. Have an EpiPen available if you deal with bees. So if you're a beekeeper, have an EpiPen on hand. Okay. Period. If you have a problem, I would take it to the next step up with your doctor. I tell them, please, I don't feel safe working around bees without an EpiPen. Okay. Tell someone close that you have been stung. Some people advocating vitamin C, there is no very strong convincing evidence that, if I take 1,000 milligrams of vitamin C before I get outdoor, and if I get stung, I take 2,000 milligrams of vitamin C. Vitamin C is harmless. You can take it with absolutely no consequences. So you can take it, no problem. I have no problem with that. But just don't think that vitamin C is going to be an immune, 100% immune treatment for you. There's a lot of, and I'm sure you have a lot of talks about bee stings and arthritis and immunotherapy and so on and so forth. There are some good data actually coming out. It's not scientifically proven. However, there is more research coming out that, what we call epitoxin or the bee venom is actually, it treats neurodegenerative diseases like Alzheimer's, like multiple sclerosis, like arthritis, like rheumatoid arthritis. So there is actually some promising data coming out. Okay, and by that, I'm going to finish my talk, and I'm going to be open to questions from anybody.
A question, Dr. Samuel, about not going to sleep. And I've heard that for concussions as well. What's the background on that? Why do we not want a patient to go to sleep? Just so we can observe them properly and see if there's any problems, like if they were talking or something?
Correct. So very important. I think this is a great question. If you get stung by a bee and you start getting into a systemic reaction, you really don't want to go to sleep because, number one, it's dark. Nobody can see you if you're developing urticaria, right? If you're developing bumps on your skin, you might not itch or see it. Others might. Okay. Remember, you might take your Benadryl and you feel okay, And Benadryl by itself is going to make you sleepy. So you say, what? Great. I'm going to take the Benadryl. I'm feeling better. I'm going to go to sleep. Okay. Next thing you know, you're developing a systemic reaction and nobody around you, and you're not aware. Same thing with concussion. In concussion, actually, we want to monitor the person's mentation. So he's doing fine. Now there is a small bleed in the brain and it's developing. He's getting a little lightheaded. He's not being as responsive. Something is going wrong. We act.
So that's one of the mistakes I made. I went to sleep. Luckily, nothing happened when I fell asleep, and I figured it's Benadryl, right?
Correct. And again, Benadryl will make you sleepy. So you actually, you want to go to sleep. It's not something that you can resist.
Right.
But you want to let people around you know, don't let me go to sleep. Or you know what, I'm going to sleep right in front of you on the couch until you call the medics.
Yeah.
Dr. Samuel, I'm hopeful that the more I get stung, the less the reaction. Is there any logic to that?
Yes, of course. You're getting your own venom, you know, immunotherapy.
So
Okay.
slow and steady, it'll get better over time. Minimize it.
Potentially, but remember, again, it can go the other way too. So again, we don't want to get complacent and say, you know, I'm getting natural immunotherapy, and the bad happens, and there's no time to react. So there is something.
I got enough venom for about 22 years.
Yeah, and you still got the reaction. So again, just be on the lookout.
Got it.
Guys, if you have any questions, please unmute yourself. You're welcome to turn your cameras on. Martha, you're saying that your dog is allergic. Sorry about that. That's terrible.
So Randy, you are monitoring the chat, correct? So I see like 20 chats. I just want to make sure. I'm sorry, what's that?
Lauren, do you have a question?
Oh, yeah, Dr. Samuel, I'm a nurse anesthetist.
Yes.
So basically what I do, facial stings, as far as I'm considered, are about the worst for anybody, even a beekeeper, to get. Just because of blood flow and everything else. So yeah, you get the stinger out, and I actually treated my husband who got stung, not a beekeeper, got stung in the lower lid inside the eye. Check for stingers. I basically treated him with 2 histamine 1 blockers. So I treated him with Zantac and Benadryl. And then I always treat with histamine 2 of the Zantac, but Benadryl and Claritin for my H1 blockers. And then I treat with either the Pepcid or the Zantac. Just like we'd treat if somebody was allergic to IVP dye in the pre-op area. I mean, obviously, the only thing I don't treat with is the prednisone or the methylprednisolone, and then I ice. Surprisingly, I did that for about 2 hours, ice on and off for 20 minutes. And the trick is get the stinger out, get the drugs on board, and ice, ice, ice. I did take him to an ophthalmologist the next day to make sure I didn't miss a stinger in his eye, and had him do a fluorescein on the eye, and it was good. And her remark was, well, why is there no swelling? I go, because I use drugs. And I think one thing that beekeepers need to know, epinephrine's appropriate for when you get down that road into a cascade of results, and dosage and placement of stings or venom is a big deal. So a lot of beekeepers get complacent thinking, well, my bees are gentle, gentle, gentle. And when there's something happen in the bee yard, like there's no nectar coming in, they just get plain mean. And the gentlest hive cannot be approached without at least headgear on and a way to close up the hive and get away. So I tell beekeepers, and obviously I say I'm not a doctor, and you need to make sure that you can take these over-the-counter medicines and you need to have a phone, somebody who knows you're in the bee yard, and you need to have if you have drugs that you have, you need to take them with you into the bee yard. And people make that mistake. And sorry, yeah, with you, Robert, but again, you should have the EpiPen on your person.
Oh, trust me, I do. I have it on me all the time now.
I think Annie's
Yeah.
trying to say, yeah, there you go.
I have a question, sorry.
Sure.
So I don't have an issue. My reaction's pretty small, but my husband helps me. And the last time he got stung, he got stung, I think it was on the foot or ankle. His whole leg up to his knee
Yes.
swelled up really badly. And he's also, you said the large local reaction would be
Right.
use the Benadryl and Motrin. But
Right.
he's on a blood thinner, so he can't take Motrin. What would be the other, what could I do instead of that for him?
Sure.
Ice,
Well,
of course, Benadryl.
So by the way, I just for the knowledge of everybody, it's not what we call an absolute contraindication. There is something called absolute contraindication and a relative contraindication. So when your husband is taking a blood thinner, he should not take Motrin on a regular basis. Okay, but if he for 1 or 2 days, it's probably okay. Now again, check with his doctor, because if he's on Coumadin and his number is just way too high,
He's
he
on
might bleed.
Allergic, if that makes
Okay,
a difference.
so Eliquis, yeah, Eliquis, you don't check blood for anything or anything like that.
Right.
But again, if you take a day of Motrin, it's absolutely fine. Okay, he can do that. Now he should not take it on a regular basis for his knee pain. He should come and see me then.
No, no, we can do that. All right, thank you very much.
Sure.
And so he could be, the last time he had one before that, his elbow got really swollen. He gets
Yes.
really swollen. Does that mean he could be on track to be getting worse and maybe
So,
need to?
not necessarily worse, but as you can see, his reaction to the sting is not the minor local reaction.
No, it's not.
It's more of the large local reaction, which can predispose him. It can swing to the other side. Okay, and that's why just to be more cautious and what we call demarcate or mark where the rash, the redness is, so it's actually regressing rather than progressing.
Okay. All right.
One thing I've noticed is that, guys, for the beekeepers, a sting in the spring doesn't hurt as much as a sting in the late fall or in the winter. You open your hive in the winter to feed them or to check on them, and you get a sting, and you get a much worse reaction. I don't know the scientific, what's happening scientifically behind it. I don't know if the venom is more potent, more concentrated, but I know it's worse when you get stung in the fall.
Yeah, I'm not sure if there's any cyclic reaction. To be honest with you, I don't know the answer to that.
Any other questions?
I have a question. I used to have the large local reaction, and then after keeping bees a few years, it's definitely gotten to be a much slighter reaction.
Mm-hmm.
But then when I go for 3 or 4 months without a sting, I almost wonder, should I try to get stung? Will my body forget? I realize at any time it could go either way, but sometimes I worry that I've gotten kind of lucky, if I've gone 4 months or so or through the winter. And is that something I want to kind of keep up with, just with one bee or something?
I really don't think so. I think that's probably not a good idea. Your body have memory cells that we keep our memory cells for the duration of our lives. You get chickenpox once, you don't get it again because you have memory cells. It remembers the virus. It never infects the body again. Let's all hope this happens to COVID as well.
Yes.
Sometime in the near future, we're gonna have immunity against it. However, I think you should not seek to be stung.
Okay.
Doctor, thank you so much for your time. I know you're a busy guy, and we really appreciate this. This is a beautiful presentation. I'm sure everybody here appreciates it. If you guys don't have any questions, I would like to release the doctor so he can go. I'm sure he's had a long day. And if you don't mind staying till about 8:30, I wouldn't mind talking about bee stuff with everybody. So if you don't have any questions for Dr. Samuel, a lot of people are thanking you. I see chats in here.
Thank you so much. I appreciate it. And keep pumping out this honey, okay? We need it.
Yeah.
It's extremely healthy.
Absolutely.
All right. You guys take care.
Thank you very much.
Bye-bye.